Hi guys, how are you? So welcome to today's session of learning. Today I want us to learn on how to take care of your perineum or perineal lacerations, perineal tear, um, perineal episiotomies after giving birth. So you all remember that it was tough, it was tedious during childbirth, and so during that process, maybe you had a perineal tear, you had a perineal laceration, or you were given an episiotomy by your midwife to allow your baby come out freely during childbirth. So today is that day. I want us to know, after now you have given birth, you have sustained that laceration, how you're going to take care of it until you heal. So first of all, I want you to understand that the perineum is that space between the vagina and the anus. So during childbirth, due to maybe when you are giving birth, when the baby's head is coming out, there's that stretching which might lead to a tear. It might tear, or when the baby's head is not coming out, your midwife might decide to give you an episiotomy. It's just to give you a cut at the perineal area so that it can allow the baby to come out. Or you might just get lacerations because of that friction when the baby is coming out. So I want us to know, how will you take care of that place until you heal completely? Because you know what, it's painful. You know, during childbirth you might not even notice that tear. You won't know. When you're giving birth, you won't even notice when you will get that tear, when you will be given that episiotomy, or when you will be getting that laceration. You won't notice, because labor pains are so intense. They just overcome this small pain of a laceration, of a tear, or of an episiotomy. But after labor immersion, that's when now you start feeling it. Pain when urinating. So unapata unafungia, you don't want to go to the toilet to urinate because of the pain. You don't want to go for a long course, you don't want to strain because that place is so painful. So I want us to know what to do ndio tupone haraka. Sawa sawa. So number one, you should have something called a peri bottle. Sawa? That is just a simple bottle, like tafuta chupa. You can even improvise. Tafuta chupa ya maji, like hizi maji za kununua dasani, or any other maji yenye unanunua, and then unaonapo juu kwa ufuniko. So you have that bottle. I wish I had a bottle, or let me get a bottle. Sorry guys, I didn't get a bottle. Imagine I don't have a bottle in my house, but nimepata hii ya Star Soft. So I'll just help you. We can even use this one to know a peri bottle. You see, get a bottle. But chukua ile yenye umenunua nayo maji. For example, I said Dasani water. See, it's this way. It has a cap. See, unaona iko hapo na ufuniko hapo juu. Wash it. Just wash that bottle clean. Wash it kabisa ingare. Wash the cap ingare. And then hapa ufuniko, the cap now, make holes hapo juu. Just make holes hapo juu kwa ufuniko, so that it's when when you pour water inside, it can be able to like come out like ni kama ukisprinkle, ni kama una sprinkle maji. So ukitengeneza hivyo, this will help you when you are peeing. It's always very, you feel like it's burning. You know, urine is acidic. So when you are peeing and you have a tear that has not healed, or you have an episiotomy that has not healed, when you are urinating, utasikia ni kama inakuchoma. So this peri bottle is just to help you cool that effect. So instead of you holding your urine, ukisikia kupee, unataka kuhold, hautaki kuenda choo because of the pain, get a bottle like that one, tengeneza hapo juu holes, then fill it with water. So when you are peeing, sasa ukienda kupee, now when you are peeing, fill the bottle with water. When you are peeing, unajisprinklia pia, like they be concurrent. Ukipee, unajimwagia hiyo maji pia kwa perineum, so that hiyo mkojo isikuchome. Sawa. Yes, that is just a tip to help reduce that pain of that is burning nature due to the acidic nature of urine. Sawa. Number 2, after now umepee, pat your perineum dry. Sawa, get a tissue, kisha maliza kupee, just pat it. Ensure it remains dry, because if it's wet, it won't heal, because this place is close to the anal region, anal hole, or how can I call it, because it's close to the anus, you are prone to infections. So make sure after umepee, pat that place, let it remain dry always. That is when you can heal faster. Otherwise, if you leave it wet, bacteria hapo ndio zinapenda, zitakuja ziaccumulate hapo, zikae hapo, uanze kupata pus. Sawa. Number 3, get your pain medications. Daktari ukitoka hosi atakuandikia dawa. Make sure you take your medications to relieve your pain, because they will help relieve your pain, so that even when you are going to pee, or when you are going for long calls, the pain won't be so much. And then use a stool softener. If you notice that your stool choo yako ni ngumu, talk to your doctor akupatie stool softener. So because you are not supposed to strain to pass stool. So remember you have a tear, or you were given an episiotomy and then ukashonwa. So I can't imagine when now still you have a fresh wound that has not healed, and then tena unaenda strain push stool to come out. That one will be double pain, and then also healing will be delayed, because ni kama hiyo kidonda you're not giving it time to heal. It's trying to kushikana, but because you are straining, it might even gap, itafunguka. Sawa. Get a stool softener. Also, drink a lot of water. It helps to soften your stool, number 1. Number 2, it helps it to prevent urinary tract infection. I can't imagine you have a perineal tear, umeshonwa, and then you have a urinary tract infection. In fact, when you have a UTI alone, without even a tear or a laceration, already inakuanga like hectic, ni painful, ni uncomfortable. Sasa imagine urinary tract infection na ukuwe na, oh my god, ukuwe na tear yenye haijapona. So to avoid this, what should you do? Drink a lot of water. By any chance usipate UTI, kunywa tu maji mingi. Be on the safe side. Kunywa maji mingi. Also it helps to reduce ile acidity ya urine. And also prevent the bacteria which causes the UTI. And then the last point, make sure you do what we call sit baths. Before utoke, your doctor will tell you. Sit baths is when you sit on salty water. Sawa. Sodium chloride. Unaeka maji yako warm, lukewarm water. Unaeka chumvi. And then you sit on the water for like 10 to 15 minutes, 3 times or 4 times a day. It will help to kill any bacteria that wants to settle there. And then it helps that wound to heal so fast. Sawa. Because ukipi, when you urinate, when you poop, so hiyo uchafu, bacteria can easily set in. So when you make an effort ya kukalia maji ya chumvi 3 to 4 times a day, even bacteria won't get space. Seriously, haiwezi, bacteria can't settle. So it will help you to heal so fast because there is no bacteria. Okay, it will kill all the bacteria and then you will heal so fast. Sawa. Yes, those are a few tips on how you should heal after getting a perineal tear. And then when should you see a doctor? When you notice that you have a foul smell discharge. That means there's a problem. Either bacteria may set in or your wound is becoming worse, it's not healing. Make sure unarudi kwa daktari very fast. And then if your pain ain't going away, even ukitumia zile dawa zenye utaandikiwa kutoka hosi, just go back and talk to your doctor. Okay? Yes, what else should I tell you? If you have a foul smelling discharge from the area, and also if you have pain that is not going away, that is when you should go back and see your doctor. And then avoid sex. Talk to your partner, or if he is not an understanding partner, tell your doctor to talk to him. Avoid sex until you heal, until your perineum heals. Sawa, because if you start engaging in sexual activities, it will gape. Those sutures, zile uzi zenye utakuwa umewekewa hapo, zitafunguka hivi. And then remember how painful it was wakati ulikuwa unashonwa? Yes. So just talk to your partner, avoid sexual activities until you heal completely. You heal completely, then you will go ahead and have sexual activities. Yes. Those are a few tips on how you should take care of yourself after getting a perineal tear or after getting an episiotomy during childbirth. Otherwise, if you don't have any question, well, if you have a question, ask me down there in the comment section. Thank you so much for watching. See you in the next session of learning.